kidneys. The kidneys filter the blood. And they do it in quite a fascinating way. Let me illustrate. Our kidneys are made up of lots of little filtering units called nephrons, and our kidney is as big as our fist. So our kidney is as big as our fist. It actually sits a little below our ribs, and each kidney has 1 million filtering units. Let me draw one of the filtering units. That's the filtering unit, and these are the tubules that the filtrate travels along before it gets down to the bladder and then, of course, is urinated out.
We will learn from Barbara O'Neill, an Australian health teacher who is internationally known for her focus on the body's natural healing potential. Disclaimer: the information provided in this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Do not disregard professional medical advice or delay in seeking it because of something you have read or seen in this video.
So from the kidneys, we have 1.5 litre loss in a day. From the colon, we have 0.3 of a litre loss in the day. From the lungs, we have a 0.2 of a litre loss. And what's a surprise to most is from the skin, we have a 0.5 of a litre loss. So that's 2.5 litre loss, so litre loss in a 24-hour period.
Barbara O'Neill highlights the critical balance kidneys maintain through homeostasis, which is the body's self-regulating process to maintain internal stability while adjusting to external conditions. This includes regulating acid and alkaline levels, sodium and water proportion, and blood pressure. The kidneys are constantly working hard to filter the blood, processing between 1 and 2 liters every 2 minutes. The nephron in the kidneys plays a crucial role in this process, filtering and balancing the blood. In a 24-hour period, the kidneys filter about 1,800 liters of blood, producing around 180 liters of filtrate. However, only about 1.5 liters are urinated daily, meaning approximately 160 liters of filtrate are reabsorbed.
Water. That's the law number 7, is use of water. Just the right amount of water alkalizes. Most people are dehydrated. That creates a very acid condition in the body. I've never met anyone that drinks too much water. In fact, Dr. Christopher said, here's a sign if you're drinking too much water, put your head on the side, and if the water comes out your ears, you're drinking too much water. Most people don't drink enough. I see a few bottles go up when I've just said that. The 8th law is trust in divine power. Now, this takes in all emotional, spiritual, and mental aspects of disease. And when a person is stressed and worried, creates an acid condition.
Barbara O'Neill stresses the crucial role of proper hydration in maintaining kidney health. According to her, drinking 500 milliliters of water all at once can be too much for compromised kidneys to handle efficiently. Instead, she suggests consuming the same amount gradually throughout the day. To ensure effective digestion, it is recommended to drink water half an hour before a meal and resume drinking 1.5 to 2 hours after eating.
So the highest concentration of mineral inside the cell is potassium. The highest concentration outside the cell is sodium. And there are sodium-potassium pumps that are in the membrane around the cell. And these sodium-potassium pumps are constantly going like this, maintaining the balance in and out of the cell. But when someone has high amounts of table salt, have you noticed people put it on and they don't even taste the food? That's because the table salt, the sodium chloride, is so harsh that it kills the taste buds. So no wonder they have to put so much on. Kills the taste buds. But the salt that we use is Celtic. And the Celtic salt, and it's called the Celtic salt because it's hand harvested by the traditional Celtic method.
O'Neill also highlights the benefits of using Celtic salt for hydration. She advises placing a small crystal of Celtic salt on the tongue before drinking water. This salt, which contains 82 minerals including 3 types of magnesium, is highly effective in promoting hydration. When placed on the tongue, the minerals in the Celtic salt are absorbed through the mucous membranes and transported to the cells via the bloodstream. Drinking water afterward helps the magnesium in the salt draw water into the cells, enhancing hydration.
We had water coming in through our mango, through our grapefruit, so you see your fruits and vegetables also supply some fluid, but we need to have at least 2 litres of pure water a day. So here's the rule of thumb. So 50 pound body weight to 1, well, I'll say quart for your sake, for 1 quart or 1 litre. So that means if someone is 100 pound, they should be having 2 quarts a day. And I guess someone gets very concerned if they're 200 pound. Does that mean I've got to drink 3 quarts a day? Well, that's a good incentive for weight loss. And if someone's only drinking 2 glasses of water a day and they're 200 pound, they can get very discouraged at that news. So you know what I say, Rome wasn't built in a day. You just start little by little by little to drink more.
In addition to internal hydration, Barbara O'Neill suggests that external water treatments, such as sitz baths, can significantly improve kidney function. She recommends alternating between hot and cold water baths to stimulate healing in the kidneys and the urinary system. This method involves sitting in a hot tub for 3 minutes, then switching to a cold tub for 30 seconds, and repeating this sequence 3 times. For optimal results, this treatment should be performed once or twice daily for 30 days, with periodic breaks in between sessions.
How many adults get up in the morning, first thing they have is, say, orange juice and a cup of coffee? Isn't that the traditional breakfast fluids? And what are they doing when they have their orange juice and their cup of coffee? They're thirsty, they're trying to hydrate, but neither will hydrate them. How clean would your body be if you washed it in orange juice? How clean would your body be if you washed it in a cup of coffee? Water and water alone will supply what the body needs.
The benefits of alternating hot and cold water treatments are numerous. Hot water causes blood vessels to dilate, increasing blood flow and promoting the delivery of oxygen and nutrients to the kidneys. This enhanced circulation can help to alleviate inflammation and support the kidney's natural detoxification processes. Cold water, on the other hand, causes blood vessels to constrict, which helps to reduce swelling and inflammation by limiting fluid accumulation in the tissues. The alternating effect of hot and cold water can stimulate the kidney's function, improve overall urinary system health, and promote a more efficient removal of waste products from the body. Barbara O'Neill emphasizes that these treatments can be particularly beneficial for individuals with compromised kidney function. Regularly incorporating these water treatments can lead to a significant reduction in symptoms such as pain, swelling, and urinary discomfort.
Now, I believe that in a well-hydrated, well-slept, well-exercised, well-mineralized body, that body copes with stress. But when a person's dehydrated, they haven't slept well, they're not eating nourishing food, they're not handling stress.
Barbara O'Neill emphasizes that getting quality sleep is crucial for maintaining healthy kidneys. According to her, although the kidneys remain active at night, they operate at a reduced pace, allowing them to rest and prepare for the next day's activities. This downtime is essential for the kidney's recovery and efficient functioning. Consistently, poor sleep can interfere with this process, impairing kidney function and increasing the risk of kidney disease. Therefore, ensuring a good night's sleep is vital for optimal kidney health.
They're not drinking enough water because they don't want to keep running to the little house. They're not having the whole salt, so they're lacking magnesium, and the highest source of magnesium is your dark green leafy vegetables, and they're not having their vegetables. So the bit of water they get is not getting in. They're not going out in the sunshine because they believed what the media told them, that the sun's going to give them skin cancer. so they don't go into the sun, so they're vitamin D deficient, so the calcium and the minerals can't get into the cell.
Barbara O'Neill emphasizes that diet plays a crucial role in maintaining kidney health. She advises limiting animal protein intake because it metabolizes into high-sulfur waste, which is acidic and irritating to the kidneys. When consuming animal foods, they should be a minor part of the diet and paired with plenty of vegetables to help alkalize the body. Avoiding harmful substances like alcohol, drugs, glyphosate, refined sugar, caffeine, and tobacco is essential, as these can damage the kidneys. Glyphosate, in particular, has been linked to kidney problems and cancer. Additionally, wheat hybridized in the 1950s has a protein structure that is difficult to break down, placing extra strain on the kidneys.
Water in and water out. Water in. Our body loses approximately about 2.5 litres of water every day. I think on days like today, the news said last night that in some places, I think out at Burka, it's 45 degrees, it's very, very hot. So a lot more perspiring. We need to take a lot more water in. Even on days like that, up to 3 litres of water a day. Important to take it in little by little by little.
Barbara O'Neill recommends incorporating water-rich foods like fruits and vegetables into your diet, maintaining a balance of 50% cooked and 50% raw items. Properly prepared legumes and whole grains are excellent sources of protein that are gentle on the kidneys. Cultured foods such as sauerkraut, yogurt, and sourdough bread are also highly beneficial for kidney health, as they aid digestion and reduce the workload on the kidneys. By following these dietary guidelines, you can support your kidney function and overall health effectively.
Gives you an idea of what the kidneys need. The kidneys need water. Because when you drink adequate water, it keeps your blood nice and thin, and it's a lot easier for that little filtering unit to filter your blood when the blood's nice and thin. So we need to be drinking at least 2 to 2.5 litres of water every day.
Many people suffering from kidney issues face challenges such as fluid retention and incontinence, which can significantly impact their quality of life. Fluid retention occurs when the kidneys are unable to remove excess water from the body effectively, leading to swelling in areas like the ankles and legs. Incontinence, on the other hand, is characterized by the inability to control urination, which can be both embarrassing and inconvenient.
Herbs, but the herbs I'm going to talk about are things that you probably have always seen as just weeds in the garden. And an important part of knowing about your weeds in the garden or your herbs is being able to identify them. But not only that, to know what you do with them, how you can use them, and why they would help you, and in what area they would help you.
Barbara O'Neill recommends using herbs like dandelion, known for its powerful diuretic properties. Dandelion helps the body eliminate excess fluid by promoting increased urine production, thereby reducing swelling and discomfort associated with fluid retention. This natural remedy can be a gentle yet effective way to support kidney function and alleviate symptoms. You can obtain dandelion tea at most grocery stores. Kidney stones are a painful and common issue that many people struggle with, but they can be managed effectively through dietary changes and herbal treatments. One of the main contributors to kidney stones is a high-acid diet, which can lead to the formation of these painful deposits.
The other organ is your kidneys. And your kidneys balance the acid alkaline in your blood in quite a fascinating way. Let me show you. This is the little Bowman's capsule. We drew it the other day, the little filtering unit. And there are 1 million in each kidney. These are the tubules where the waste is taken away. There's the filtering units. So the blood goes in, the blood weaves around the filtering units and comes out, and it weaves around the tubules. 1,800 litres of filtrate is filtered out of that little Bowman's capsule in a 24-hour period. That's out of your 2 million little filtering units. 1,600 is reabsorbed approximately, because approximately 1.5 litres is urinated out.
Barbara O'Neill recommends adopting a high alkaline diet to help prevent and manage kidney stones. Consuming foods that are low in acid and high in alkaline can help reduce the formation of stones and support overall kidney health. Foods such as leafy green vegetables, fruits, nuts, and seeds can create an alkaline environment in the body, which helps to dissolve existing stones and prevent new ones from forming.
So how do we help the water get into the cell? There are 4 vital elements needed for life. Let's look at the 4 vitals. These 4 vital elements needed for life indicate what we need. Number 1 is oxygen. Now that's not a surprise. Oxygen's the most vital element needed for life. Number 2 is water, and that's not a surprise. But what's a surprise to most people is the 3rd vital element needed for life is sodium. You think about it, we're salty people. Our tears are salty, our blood's salty. Baby swims in utero in salt water.
In addition to dietary changes, specific herbal treatments can be highly effective in managing kidney stones. Juniper berries are one such remedy. These berries help to increase kidney filtration and urine flow, which can aid in flushing out bacteria and small stones from the kidneys. By incorporating juniper berries into your diet, you can support the natural cleansing processes of your kidneys and reduce the likelihood of stone formation. Make sure to check with your healthcare provider first before taking
castor oil. And castor oil is something that penetrates deep into the body. I never advise taking castor oil by mouth because it can be quite irritating. So I'm going to show you how to make a pack. So here is, I think we're familiar with them, they're blueies. Oh, this is a greenie, but it's an incontinence pad. So what we do is we get those and we cut them and we take off that top layer and we put several layers in there. 1, 2, 3, 4, 5. I've got 6 layers of that oil sheeting in there. You see, the thicker the compress, the more castor oil it can hold, and the more castor oil that can go into your body. And what we do then is we tape the edges. And the reason we go to a bit of effort to do this, you can also stitch the corners because this is a compress, so it can be used again and again and again and again.
Another powerful treatment suggested by Barbara O'Neill is the use of castor oil compresses. Castor oil has properties that can penetrate deep into the tissues and help break down kidney stones. Applying a castor oil compress over the kidney area for several hours a day can aid in dissolving stones, making them easier to pass. This natural remedy not only helps to alleviate the pain associated with kidney stones, but also supports overall kidney health by promoting the removal of toxins and waste products. Urinary tract infections are a common and often painful issue that many people face, characterized by symptoms such as frequent and burning urination, and sometimes pain in the lower abdomen. Managing UTIs effectively involves both prevention and treatment strategies.
The first place that the water is taken from is the lining of the stomach, and the first place it goes to is the lining of the stomach. So a glass of water, half an hour before the meal, the first thing it'll do is it'll thicken that mucosa lining on the stomach.
Barbara O'Neill emphasizes the importance of staying well hydrated to help manage UTIs. Drinking plenty of water helps to flush out bacteria from the urinary tract, reducing the risk of infection and promoting overall urinary health. Adequate hydration is one of the simplest and most effective ways to prevent UTIs. In addition to drinking water, incorporating specific herbs into your regimen can provide additional support. Cranberries are well known for their ability to prevent UTIs. They contain compounds that prevent bacteria from adhering to the walls of the urinary tract, thereby reducing the likelihood of infection. Drinking cranberry juice or taking cranberry supplements can be an effective way to utilize this natural remedy. Golden seal is another powerful herb recommended by Barbara O'Neill for managing UTIs. It has strong antimicrobial properties that help fight off infections and support the health of the mucous membranes lining the bladder. Golden seal can be taken in capsule or tincture form, providing a natural means to combat the bacteria causing the infection. Combining these herbal treatments with good hydration practices can significantly reduce the occurrence and severity of UTIs.